Medicaid expansion is a debate that has stretched on for years.
Right now in Texas, only low-income adults who are seniors, care for children, or have a disability can be eligible for Medicaid. Texas is one of 14 states that has not adopted Medicaid expansion, where people could qualify specifically based on their income. KXAN's Steffi Lee reports on the push to let the voting public decide.
It's time to put politics aside and
organizers shivered in the cold to stretch out this line of paper cutouts. They represent Texans who'd be covered if the state expanded Medicaid. Texans like Marjorie Gonzalez.
I live in an apartment with like a gas stove, and then we had a carbon monoxide leak, and my first response was like, no, I don't want an ambulance because I can't afford it. I don't have health insurance.
Dr. Rupa Nalam sees Texans like those in her practice.
I'm thinking of one in particular where she had a heart transplant and she didn't get her transplant medications because she didn't have health care coverage.
These ralliers want Texas to let voters decide on expansion. Nebraska, Idaho, and Utah voters approved it last year.
One problem with Medicaid across the board:
top Texas leaders haven't supported the idea in the past.
If something's broken, you don't just make that thing bigger to make it fix.
David Ballot with the Texas Public Policy Foundation says rather than Medicaid expansion, lawmakers should tackle specific areas of health care access.
Are the reimbursement rates equitable where physicians will want to see those patients? The ability for patients to be able to refer to specialists, it's already very difficult.
State Senator Nathan Johnson feels a shift in the Texas landscape where Medicaid is concerned.
There's no question about it. How far has it shifted? Are we at the tipping point just yet? We'll find out.
Steffi Lee, KXAN News.
A poll by the Episcopal Health Foundation finds that Texans want lawmakers to address the following health topics: lowering prescription drug costs, lowering health care costs, increasing access to health care, and increasing funding for mental health programs. Also, working on maternal mortality.